On Africa 24 English, the African Union Journal is presented to you by Afreximbank.
Thank you for joining us on this edition of the African Union Journal, your weekly rendezvous on news around the African Union. In this edition, we will be looking at the efforts of the African Union in building a resilient health system and improving the status of women in Africa. Africa continues to face the resurgence of health challenges, with limited resources to tackle these challenges. The continent accounts for only 3% of global pharmaceutical production, which provide a crucial opportunity to foster the development and coordination of public-private partnerships. Catherine Gobe gives us more details in this report.
In 2020, the World Health Organization reported that 25% of the world's sick people, all diseases combined, are African. With this in mind, African leaders are campaigning for far-reaching reforms to build a health architecture capable of achieving health independence by 2050. It is in this context that the pharmaceutical sector is a major challenge, in that access to affordable quality medicines as well as the implementation of appropriate public policies and public-private partnerships are factors in the development of the sector's growth potential in Africa.
Vaccine equity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products.
The United Nations believes that the COVID-19 pandemic has highlighted Africa's inadequate capacity to manufacture and supply essential medicines. Although Africa is home to 17.2% of the world's population, it produces only 3% of the world's pharmaceuticals, 375 manufacturers in 37 African countries. Over 80% of pharmaceutical and medical products are imported into the continent. Hence, the importance for experts of developing partnerships with international organizations to improve local production.
The Gavi, the Vaccine Alliance, at its December board meeting, it approved an instrument called the AVMA, Africa Vaccine Manufacturing Accelerator, which is a very important tool of 1 billion that will actually be strengthening the African vaccine manufacturing. So through that, we are hoping that we can get into a space where Africa can contribute to the manufacturing of its own vaccines.
The demographic boom in Africa and the growth forecast for the next 20 years could be the catalyst for change, as demonstrated by various development projects in the health sector, such as Gipto Pharma City, Egypt's new regional center for the pharmaceutical industry in the Middle East. With a view to meeting the needs of a growing population, CDC Africa plans to open 5 new vaccine manufacturing sites by 2040.
Africa CDC, nous faisons un programme.
In Africa CDC, we are running a major program called Local Manufacturing of Vaccines, Medicines and Diagnostic Tests. Our ambition is to have at least 60% of all these products manufactured in Africa by 2040.
60% de tous ces produits fabriqués en Afrique.
Insufficient human resource capacity and policy inconsistencies between trade, industry, health, and finance departments are also hampering the growth of Africa's pharmaceutical sector. According to the AFDB, when all African countries ratify the FTAA agreement, it will include a market of 1.3 billion people and potentially 2.2 billion by 2050.
Africa represents approximately 17% of the world's population, accounting for more than 50% of deaths from transmittable diseases worldwide. Less than 50% of Africans have access to essential health services, according to official data. a situation attributed largely to the lack of quality infrastructure and human resources in the health sector. Member states are undertaking ambitious projects in the area of infrastructure, human resources, and health financing. Mildred Yamo gives us the details.
Africa has 1.3% of the world's health care workers, yet it bears 25% of the global disease burden, according to the World Health Organization. WHO estimates show that the deficit of health personnel on the continent will stand at 6.1 million by 2030. Less than 50% of Africans have access to essential health services. Meanwhile, according to experts, making access to quality health care a priority contributes to efforts to accelerate the African Union's Agenda 2063. The challenges of African health systems are essentially based on the lack of adequate infrastructure and human resources. According to the World Health Organization, for every 10,000 inhabitants, a minimum of 23 skilled health personnel is required. We are aware that Mali does not even have 10. In places sometimes we do not even have 5 health workers per 10,000 inhabitants, but we are developing strategies to ensure quality health care for our populations. We are doing this especially by sending community relays to community health centers, which are closest to the populations, who are not necessarily health workers, but who receive training to be able to detect patients and direct them to the nearest health centers when need arises. The shortage of health professionals in Africa is mainly linked to lack of training, poor working conditions, and the absence of incentives. These factors contribute to keeping health workers away from regions where the needs are greatest. The challenge linked to the lack of quality infrastructure is notably attributed to insufficient financing and conflicts. According to the African Development Bank, Africa's production losses caused by health problems are estimated at around $2.4 trillion per year.
Nous avons des initiatives de mise en place de nouvelles usines de production.
We have initiatives to set up new drug production factories, and we are working to ensure that Burkina Faso is as independent as possible in terms of pharmaceutical production. In Burkina Faso, every year we recruit at least 200 to 300 general practitioners in the public service. In the country, every year we launch professional entrance examinations for specialized doctors and pharmacists, around 150 to 200, which means that in terms of human resources, I am not saying that we have filled the entire gap, but great progress has really been made. Our biggest challenge in terms of human resource production is the distribution of personnel.
Notre plus gros défi en matière de production des ressources humaines, c'est beaucoup plus la répartition du personnel.
With the resurgence of diseases such as malaria, cholera, HIV and AIDS, and tuberculosis, as well as an increased risk of infant and maternal mortality in Africa, states are shifting their priorities more towards health. In Nigeria, for example, a West African country where around 6 out of 10 people do not have access to quality primary health services, projects are underway in the areas of infrastructure, human resources, and health financing. The government plans to invest $3 billion to train 120,000 frontline health workers in 16 months and double the number of primary health centers in communities from 8,800 to more than 17,000 by 2027.
Le budget 2024 que nous mettons en œuvre aujourd'hui prévoit l'allocation la plus élevée aux soins de santé de l'histoire de notre pays. Nous inscrivons environ 68 000 infirmières chaque année dans nos écoles. Avant la fin de cette année 2024, nous accueillerons près de 120 000 infirmières dans nos différentes écoles de formation du pays. Nous construisons également 6 pôles d'industrialisation médicale dans chacune des 6 zones géopolitiques.
The president has put in place a committee to look into how we can improve the welfare packages of our healthcare professionals. The $4.5 billion invested each year by African governments in equipment falls well short of the estimated $26 billion in annual investments needed to meet health needs over the next decade, experts say. Noting the importance of primary health care in building a resilient and integrated health system in Africa, experts affirm that faced with the problems of limited health professionals and the geographical isolation of rural populations, telemedicine offers solutions.
In sub-Saharan Africa, 34% of young people aged between 18 and 24 are victims of cyber harassment, and 20% of dehumanizing content online targets African women. Governments are multiplying efforts to include women in Africa's digital transformation, offering new opportunities in a context where more than 230 million jobs will require digital skills by 2030. Details in these reports. In 2024, breaking the gender-digital divide is a question of safety. Official data reveals that in sub-Saharan Africa, 34% of people aged between 18 and 24 are victims of cyber harassment. Parallel studies indicate that 20% of dehumanizing content posted online targets women of African origin. Faced with the rise of cybercrime in the continent's digital landscape, the African Commission on Human and People's Rights is recommending that women should have access to education in digital technology in order to eliminate the digital divide between the sexes.
Online gender-based violence, safety and security. Now, if we don't interrogate these barriers in their entirety, we're never going to really be able to address the digital gender divide, because it's not simply about access and use of the internet.
Sub-Saharan Africa has the largest internet access gap in the world. In the region, 97 million women do not have a mobile phone, and men are around 50% more likely to have access to the internet than women, revealed the United Nations. After the cost and inadequacy of digital infrastructure, the low female literacy rate is the third largest factor in the gender digital divide in Africa.
Statistiques et chiffres qui, au-delà des récits,
a few statistics and figures which, beyond the stories, will serve as evidence to underline the importance and urgency of investing in girls' education. The education of girls and women must receive immediate attention. In Africa, 32.6 million girls of primary and lower secondary school age are not in school.
Et au premier cycle du secondaire ne sont pas scolarisés.
Digital literacy programs for women are proliferating on the African continent. The main aim of this initiative is to root Africa in the process of its digital transformation. Including women in the digitalization process will also open new opportunities for this section of the population, as more than 230 million jobs will require digital skills by 2030.
The Africa Educates Her campaign, in particular, has been instrumental in engaging member states, CSOs, youth development partners, focal points in gender and education ministries across the continent and the Pan-African Parliament. Through the campaign, progress for girls' education has been forefronted.
2024 has been designated the Year of Education by the African Union. On the continent, health, security, climate crisis have highlighted the need to focus on online academic training and e-learning to reduce the school dropout rate among young people, particularly girls. In sub-Saharan Africa, where only 6% of young people are enrolled in higher education, the e-learning market is worth nearly $3 billion a year, with growth prospects of 7.3% by 2025. On to our news in brief. Launch of the Pan-African Reserve and Resource Reporting Code in Africa. The Southern African Development Community Labour Protocol signed by Angola, Malawi and Lesotho. Tunisia assesses its 2-year term at the African Union Peace and Security Council. On 3rd April 2024, the African Union launched the Pan-African Resource Reporting Code. In a continent that is home to 54% of the world's platinum reserves, 78% of diamonds, 40% of chromium, 30% of oil and gas reserves, and 28% of manganese reserves. The implementation of the African Mineral and Energy Resources Classification and Management System and the Pan-African Resource and Reserve Reporting Code should, according to the African Mining Development Center, make it possible to establish a unified stock market and financial reporting framework, promoting responsible investment in regional and global mineral value chains. Angola, Malawi, and Lesotho signed the Southern African Development Community Protocol on Employment and Labor on 28 March 2024. Introduced in 2014, the SADC Protocol on Employment and Labor aims to harmonize working practices and conditions in member states. According to some experts, the signing and ratification of this protocol should also help to speed up the integration program drawn up by the SADC members. Tunisia's term of office on Peace and Security Council of the African Union ended on 31st March 2024, after 2 years during which the country held one of the 2 seats allocated to the North African region within this important African structure. In a press release issued on 31st March 2024, the Tunisian Ministry of Foreign Affairs stated that the North African country had carried out this mission within the Pan-African institution with the same determination and commitment that have always characterized its foreign policy and its contribution to the service of international peace and security in general, and in Africa in particular, on the basis of the principle of African solidarity and integration. This was the second time that Tunisia sat on the African Union Peace and Security Council since its creation in 2004. And now we talk of Africa's resilience to climate change. Climate change today represents one of the greatest challenges for humanity. Like other continents, Africa is not immune to this global threat. A number of measures and strategies can be put in place to make agriculture resilient in the face of climate change. Samantha Sebero gives us more insight. With heat waves, drought, and variable rainfall, crop losses have tripled in Africa between 2019 and 2023, and will continue to rise, jeopardizing farmers' means of production, according to the French Development Agency. A number of measures and strategies can be put in place to build agriculture that is resilient in the face of climate change.
We are very pleased with the decades-long sustainable partnership that the U.S. and Africa rise naturally through the African Development Bank's Technologies for Transforming African Agriculture program. Since it began in 2018, we have noticed that it had a huge impact. Rice yields have increased by 25% in all the countries where the project has been implemented. People's quality of life has also improved significantly, and production is over 1 million tons.
The Intergovernmental Panel on Climate Change advises that African countries should promote the use of seeds adapted to local climatic conditions, capable of withstanding drought, flood, and disease. Efficient irrigation and water management will make it possible to cope with periods of drought and extreme rainfall. This can include building water reservoirs, using more efficient irrigation techniques, and collecting rainwater.
The work that Africa Rice has been doing for a very long time to maximize crops and produce crops capable of withstanding climate change and other climatic hazards that may arise. The focus on food, as we have just heard, to ensure self-sufficiency to feed Africa and also the world is to be commended.
African countries are among the most vulnerable to the effects of climate change, suffering the disastrous consequences of climate crisis, including drought, flood, extreme temperatures, and rising sea levels. In 2022, more than 7.5 million internal displacement due to disasters were recorded on the African continent, according to World Bank data published in 2023.
Add, from our perspective, that
I just want to add that from our point of view, there are extraordinary innovations that are not just possible, but are happening and making a difference. And what really strikes me is that a few years ago, when we were facing a wave of crises that are seriously impacting food security around the world, climate change, COVID-19, conflict like the one between Ukraine and Russia, we have seen the damage, and obviously, in that kind of situation, you try to do everything you can to help. That's really the position of the United States.
That's exactly what the United States did.
According to an analysis by the African Climate Policy Center of the United Nations Economic Commission for Africa, a 3-degree Celsius rise in temperature across Africa could lead to 8.2% drop in continental gross domestic product, and a 4% degree Celsius rise in temperature could lead to an even more dangerous 12.1% reduction in gross domestic product.
The 10th session of the African Regional Forum on Sustainable Development will be held in Addis Ababa, Ethiopia from the 23rd to the 25th of April 2024 under the theme Strengthening the 2030 Agenda for Sustainable Development and Agenda 2063 and Eradicating Poverty in Times of Multiple Crises, Effective Implementation of Sustainable, Resilient and Innovative Solutions. The forum will bring together policymakers and experts from ministries and agencies responsible for finance and economic development, social affairs, the environment and natural resource management, and many others. One of the objectives of this 10th session is to enhance learning and advocate effective policy measures and actions at national, regional, and global levels to advance the implementation of the SDGs and the goals of Agenda 2063. Tehran, the capital of Iran, will host the second Iran-Africa Business Summit from the 26th to the 29th of April 2024. Ministers of economy from more than 40 African countries will take part in this meeting. Since 1386, economic relations between Africa and Iran have deteriorated as a result of the economic crisis and international sanctions against Iran. In recent years, due to the lack of recovery of economic relations with Africa, the amount of trade with Africa has remained at the level of $1.2 billion. According to Mohammad Sadek Ghanazadeh, Director General of the Trade Promotion Organization of Iran, increased trade with Africa could generate $10 billion over the next 3 years. The 59th annual meeting of the Board of Governors of the African Development Bank and the 50th annual meeting of the Board of Governors of the African Development Fund will be held from the 27th to the 31st of May 2024 in Nairobi, Kenya, under the theme Africa's Transformation, the African Development Bank's Group and the Reform of the Global Financial Architecture. This event is a platform for reflection on the African Development Bank's group commitment to fulfilling its mission of developing the African continent and improving the living conditions of its people.
Mouna Osman Aden is the Minister of Women and Family in the Republic of Djibouti. She has always distinguished herself in her perpetual fight to improve the status of women in Africa. Her long-term objective is to ensure that states are better integrated into the dynamics of social progress. Details of the activities of this female leader. A member of the African Peer Review Mechanism, Mouna Osman Aden is a leading figure in the field of social protection in Africa. Her role as Minister of Women and Family in the Republic of Djibouti since 2016 demonstrates her commitment to improving the living conditions of women and families. We collectively affirm a commitment to gender equality, social justice, and building a future where every individual, regardless of gender, can realize their full potential. Mouna Osman Aden has always confirmed her leadership in working to eliminate gender discrimination, for greater access for women to political and administrative responsibilities. In 2021, for example, 6 out of 24 ministers in Djibouti were women. There were 7 women parliamentarians in 2013 and 17 in 2018, and 7 out of 10 members of the Supreme Court were women. This gender strategy serves as a framework for promoting equality at all levels of society, focusing on empowering women, creating equitable opportunities. The inclusion of women should not be seen as a mere obligation, but as a pragmatic strategy for strengthening stability. Legal text aimed at improving the situation of disabled and elderly people in society were among the African initiatives taken to promote social protection in 2017. Through legislation, Mouna Osman Aden has pushed through a national strategy for social protection between 2018 and 2022, based on a call of rights supported by the state, in line with the United Nations Sustainable Development Goals.
La mise en œuvre de cette stratégie.
The implementation of this strategy and action plan marks a crucial stage in the recognition of the essential role of women in consolidating peace and building a more stable and prosperous future.
Plus stable et prospère.
As a member of the Global Partnership for Universal Social Protection 2030, Mouna Osman Aden has always focused on the economic empowerment of women and the building of inclusive and equitable societies. Ladies and gentlemen, thank you for being with us on this edition of the African Union Journal. Stay tuned for more programs on Africa 24 English.
On Africa 24 English, the African Union Journal is presented to you by Afreximbank.